Well, good morning, 8:53. A growing number of teens undergoing plastic surgery. So in today's Mommy Daddy Handbook, Dr. Stephen Cohen is here with more on this trend. Dr. Cohen, good morning. Thank you for being here.
Thank you.
You know, we're just talking a little bit about plastic surgery in teens, and times have changed from when I was a teenager to maybe what teens are facing nowadays. We were talking about this, and I'm curious to know, has plastic surgery changed among teenagers today?
You know, I don't think so. I think the publicity surrounding it has increased, but I think that the options and the treatments have been available for years and years and years.
Why do teens want to get plastic surgery even to begin with? It's like a odd time in their life, right?
Well, a small segment for the wrong reasons. You know, they're watching TV and they go, wow, this could be me. But most come in because, you know, they have a deformity of the nose, or the ears are prominent, or they may have a congenital breast, you know, asymmetry that's really severe. So in the locker room, they're uncomfortable around their peers. Most of them are coming in for those kinds of, you know, reasons rather than to enhance normal items.
Do you think with this day and age with social media, though, teens are being exposed to these images that are just not real? They're airbrushed or whatnot, that they say, I want to look like this person, doctor.
My job is to explain to them that it's not buying a pair of shoes, and these are changes that last, in some cases, a lifetime. So these are decisions you kind of have to make at different stages. And oftentimes you put them off until really college years when they're able to make more of an adult decision.
We have some pictures of teens that have gone, you know, through some plastic surgery. My question would be, as we're looking at some of these pictures, because I know that you do some of these corrective procedures, is a teenage years a time to even be doing plastic surgery, or is the body still changing at that point that you really shouldn't be doing much?
The answer really is yes and no, because it's complex. For instance, if a young lady's breasts are just growing beyond consideration, you know, a young lady like that, it's probably a good idea to do that.
And then some of these pictures that we're seeing, what are these, chin?
So these are you know, patients that actually are having jaw surgery. You know, so it looks like the chin is being advanced, but it may be the entire jaw. Or a kid like this, you know, they're having their ears, you know, pinned back because they're not going to change no matter what age. Rhinoplasty, the same thing, you know, oftentimes associated with breathing problems as well.
So in that teenage year, when you're trying to identify with a group or friends or whatnot, let's say your teen goes to mom and dad and says, Mom and Dad, I don't feel right about this. I don't feel right about this. How should parents be responding to the kids?
Well, I mean, parents should be supportive, but they should acknowledge if a kid is, you know, pointing out a real, you know, problem. You know, if somebody's pointing out something that's a little bump they don't like, that's very different than somebody pointing out, you know, a huge nose where they also have difficulty breathing. So you have to always look at these things in the context of, you know, what is real, what is a little over real.
What is over real? We know teenagers know very well. Dr. Cohen, thank you for being here.
Thanks for having me,
We
Shelley.
appreciate it. 8:56, Erica, we'll get it over to you.
All right, thank you.